Okay, let's dive into something that, well, it often starts simply, but can take a pretty worrying turn.
Hmm.
You're probably familiar with a urinary tract infection, a UTI, in a dog or cat. It's common, usually treatable, right?
Yeah, most people have heard of those.
But what if that infection doesn't, stay put? What if it travels upwards, deep into the kidneys?
Oh, okay. Yeah,
That's when we're talking about a much more serious condition called pyelonephritis.
exactly. It moves beyond the bladder, right into the kidney itself. And as the professional veterinary sources we're looking at for this deep dive made clear, that's where things can get complicated.
And potentially quite dangerous for a pet.
Definitely.
And that's our mission today. We're taking these sources, specifically a chapter from a veterinary professional text focusing on canine and feline pyelonephritis, and we're going to unpack everything you need to know.
Sort of extracting the key knowledge.
Yeah, the goal is to extract the most important nuggets, understand the nuances of this condition,
Hmm.
and figure out why it's so important for you as a pet owner or someone who just cares about animals to be aware of.
Hmm. We want to guide you through maybe the technical details, but in a way that highlights what really matters,
Yeah.
helping you understand the potential hidden nature and the seriousness of pyelonephritis.
Okay, let's unpack this then. What is pyelonephritis according to these sources? How is it different from just a regular old bladder
Uh-huh.
infection?
Well, the sources define it specifically as microbial colonization of the upper urinary tract.
Okay, upper tract.
So it's not just the bladder. It involves the renal pelvis, which is
Mhm.
kind of like the collecting funnel inside the kidney,
Got it.
the smaller collecting diverticula, the renal parenchyma, that's the actual functional kidney tissue,
Right.
and the ureters, those tubes carrying urine down from the kidneys.
So it's really taken that bacterial road trip way up the system.
Precisely.
Mm.
And because it usually involves more than just the renal pelvis itself, the sources note that upper urinary tract infection is often a more accurate description.
Makes sense.
And our focus today is specifically on bacterial pyelonephritis, as that's what's covered in this text.
Got it. Upper tract caused by bacteria. Which leads us to the next question. How does this happen? How do these bacteria even manage to get all the way up there?
Yeah, that's where it gets really interesting. The sources explain that it almost always requires some kind of breakdown in the pet's normal defense mechanisms against UTIs.
Like the body's security system.
Exactly. Think of it like a multi-layered security system protecting that upper tract.
Right.
You've got mucosal barriers lining everything to the natural wave-like contractions of the ureters pushing urine down, that's peristalsis.
Okay.
Special flap valves where the ureters enter the bladder that stop urine flowing back up.
Anti-backflow valves.
Right. Plus the constant one-way flow of urine flushing things out, and even the kidney's own blood supply plays a role if any of these defenses are compromised.
It creates an opening.
It creates an opportunity for bacteria to ascend, yeah.
So the bacteria exploit a weakness in the system. And the most common way they do that, according to the sources,
It's overwhelmingly from a lower urinary tract infection. They climb upwards from the bladder. This is a really crucial point the sources emphasize. Unlike in some other types of infections, getting it through the bloodstream hematogenous seeding, that's not the usual cause of pyelonephritis in dogs and cats.
Okay, so it doesn't usually come from somewhere else in the body via the blood?
Not typically, no. The problem usually starts down below in the bladder and moves up.
So if a pet has a bladder infection, the bacteria are right there, poised, ready to potentially make that climb if the defenses aren't quite perfect.
Exactly. And the sources confirm that an upper UTI, like pyelonephritis, is very frequently found alongside an active lower UTI.
Okay.
But it's not only about ascending from the bladder. The sources also describe how pyelonephritis can develop secondarily to infection within metabolic nephroliths, kidney stones.
Kidney stones, right. So the infection can be in the stone.
Yes. And they even point out this fascinating and, frankly, worrying cycle. Certain bacteria that produce an enzyme called urese can actually predispose a pet to forming specific types of stones, like struvite stones.
Wow. Wait, so the infection can help create the stone, and then the stone gives the bacteria a place to hide out, making the infection worse and harder to get rid of. That sounds like a really vicious cycle the sources are highlighting.
It absolutely can be.
Mhm.
And understanding this pathway helps explain why these stones are such a significant complicating factor.
Okay. So what does all of this mean in terms of, the actual danger for the pet?
Well, a major point stressed in the sources is that obstruction of an infected kidney or its ureter is a huge danger.
A blockage.
Yeah, It can rapidly lead to septicemia. That's a widespread bacterial infection in the bloodstream, sometimes called urosepsis. It can affect any body system.
And the sources describe that as?
A medical emergency. Needs immediate attention.
So something that might start with seemingly minor signs can quickly escalate to a life-threatening situation, especially if there's a blockage involved. Okay, so who typically gets affected by pyelonephritis? Are there specific breeds, ages, sexes more prone?
Well, according to the sources, the exact incidence, how often it happens, is actually unknown.
Really?
Yeah, they strongly suspect it's much more common than is clinically recognized.
Why is that?
Largely because, as you mentioned, many animals show no outward signs specific to the kidneys, or they might only display symptoms of a lower UTI, just a bladder infection signs.
So it's often a hidden or silent problem?
Frequently, yes. In terms of species, it's detected more often in dogs than in cats.
Okay.
Age-wise, dogs of any age can be affected. For cats, it's a bit different. While UTIs in general are uncommon in young to middle-aged cats, maybe 1–3%, the frequency really jumps up in older cats, those over 10 years. It's seen in over 10% of them.
Interesting split there. And sex, does that play a role?
The sources state the specific sex incidence for pyelonephritis isn't well defined. But if you look at UTIs generally, more females are affected in dogs, while in cats, UTIs happen with pretty similar frequency in both males and females.
Okay, so the picture on who gets it is a bit murky. More common in dogs, maybe linked to age in cats for UTIs overall. So what should someone watching their pet actually look for? What are the signs?
Again, this is a really critical point from the sources, something you should absolutely remember. Many patients are asymptomatic.
No signs at all.
Or they only show signs of a lower UTI.
Meaning you can't just wait for obvious kidney pain symptoms to show up.
Exactly. The history an owner might report could include the pet being totally asymptomatic or maybe having increased thirst and urination polydipsia.
DUPD.
Yeah. Or rarely showing abdominal or lumbar pain. More commonly, though, you might just see the typical signs of a bladder infection. Difficulty or pain during urination, dysuria, needing to go out more often, polyuria, having accidents inside periuria, straining to pee, stranguria, maybe blood in the urine, hematuria, or urine that looks or smells funny.
Okay, the classic UTI signs we might recognize. And if a vet is examining the pet, what might they find?
Well, the pet might be asymptomatic on physical exam too, or the vet might feel pain when they gently palpate the kidneys.
Feeling around the kidney area.
Right. A fever is possible. The sources also mention that kidney size can be abnormal. Sometimes they feel smaller in chronic cases because of scarring, or maybe enlarged in acute cases due to the inflammation.
So asymptomatic is a really key word here. It's not always obvious. That must make diagnosis tricky, which I guess we'll get to. But first, let's talk about why some pets get this. Besides that breakdown in defenses we talked about, what are the common causes and the big risk factors?
The sources confirm it's usually caused by ascending aerobic bacteria, just like standard UTIs.
The ones that need oxygen.
Right. And the most common culprits they list are Escherichia coli and Staphylococcus species.
E. coli and staph. Yep, the usual suspects we always hear about with UTIs.
They are, but others can do it too, like Proteus, Streptococcus, Klebsiella, Enterobacter, and Pseudomonas.
Okay.
The sources consider other things like anaerobic bacteria, ureaplasma, and fungi to be pretty uncommon causes.
And what makes a particular pet more vulnerable? What are the conditions that really increase the risk?
The sources list several key predisposing factors. Anatomical abnormalities are a big one.
Like birth defects?
Yeah, things like ectopic ureters, where the ureter connects in the wrong place, or vesicurital reflux, where urine flows backwards from the bladder up towards the kidneys.
Oh, okay.
And congenital renal dysplasia, which is abnormal kidney development right from birth. These things mess up the normal flow and defenses.
So structural issues, basically. Problems with the plumbing.
Pretty much. Then other urinary tract conditions themselves are major risk factors. A lower UTI is the primary one, as we said.
Makes sense.
But also uroliths, stones, urinary tract neoplasia tumors, problems with urine retention, and even procedures like putting in a urinary catheter or doing a peritoneal urethrostomy surgery can increase risk.
And can broader health issues set the stage, too? Like other diseases?
Absolutely. Anything that weakens the immune system or affects kidney function can play a role. The sources specifically list systemic diseases like diabetes mellitus,
Sugar diabetes.
right, hyperadrenocorticism, which is Cushing's disease, the use of exogenous steroids like prednisone.
Oh, interesting. Steroids can increase risk?
It can suppress the immune response, yeah. And even existing renal failure itself makes them more susceptible.
So it's kind of a mix of local urinary tract issues and maybe wider systemic problem.
Exactly. And the sources cite this really interesting experimental finding in cats that highlights this interplay.
What was that?
They found that the combination of having an indwelling urinary catheter and being given exogenous steroids frequently resulted in pyelonephritis when a lower UTI was deliberately induced.
Wow. So multiple risk factors layering together really ramps up the danger.
It really shows how these things can combine to increase vulnerability, yeah.
That's a fascinating insight into the complexity. Okay, so if you have a pet with maybe some subtle signs or perhaps just a history of recurrent UTIs, how does a vet actually figure out if pyelonephritis is the underlying problem? What does that diagnostic journey look like?
Well, the sources are very clear on this. A clinical diagnosis is often presumptive.
Meaning it's suspected, but not 100% confirmed.
Exactly. It's based on putting together the information from various tests and imaging. Getting a definitive diagnosis by actually sampling the kidney isn't usually required to start treatment.
Okay, so they don't always have to go straight for a kidney biopsy or something invasive like that.
No, not typically, at least not for initial treatment planning. And because it's so often asymptomatic, the sources really stress that any patient with a confirmed UTI should be considered as potentially having pyelonephritis.
That's a huge takeaway for the listener then. A simple UTI diagnosis in your pet means pyelonephritis has to be on the radar.
It really should be. Now, the best methods for presumptively differentiating an upper from a lower UTI, according to the sources, are things like ultrasonography or maybe excretory urography.
Imaging tests.
Right. Ultrasound is noted as being particularly sensitive for detecting mild to moderate acute cases.
Okay.
The sources also suggest thinking about pyelonephritis whenever you see a pet with a fever of unknown origin, that increased thirst and urination we mentioned, PUPD, signs of chronic renal failure, and the lumbar or abdominal pain, even though that's less common.
What about the routine lab work? Blood tests, urinalysis, do they help pin it down?
They're definitely part of the picture, but they have limitations for diagnosing pyelonephritis specifically. A CBC, the complete blood count, might be normal, especially in chronic cases.
Sure.
Though some acute cases might show elevated white blood cells, suggesting inflammation. The biochemistry panel is typically normal unless chronic pyelonephritis has already caused chronic renal failure.
Then you'd see the kidney values go up.
Exactly. You'd see azotemia, the elevated kidney markers, plus often dilute urine.
And the urinalysis itself, that feels like it should be the big indicator for a urinary tract problem.
It's important, definitely, but again, there are nuances here. A urinalysis may show signs like blood, pus, which is called pyuria protein or bacteria.
Right.
The sources mention something called leukocyte casts. These are basically little moles of inflammatory cells from inside the kidney tubules, and seeing them is diagnostic for inflammation within the kidney.
Ah, okay. So that's definitive.
Well, diagnostically useful, yes, but unfortunately the sources say they are very uncommon in dogs and cats with pyelonephritis.
Oh, so you don't see them often.
No. Dilute urine is also possible, as we said. But the absolutely critical point the sources make, and this is huge, is that the absence of these findings on a urinalysis does not rule out pyelonephritis.
Wow. Hold on. So a clean-looking urinalysis doesn't mean the kidneys are definitely okay if you suspect pyelonephritis. That feels counterintuitive.
It does, and it's why the quantitative urine culture is described by the sources as essential.
The culture, growing the bacteria.
Exactly. This confirms that there is a UTI present, and critically, it gives you susceptibility testing. That tells you which antibiotics will actually kill the specific bacteria involved.
So you're not just guessing with antibiotics.
Precisely. The sources also note something important for chronic cases. Dogs with chronic pyelonephritis might actually have negative cultures on a single test.
So one negative test isn't enough.
It might not be. They may require multiple cultures over time to actually detect the infection, if it's sort of deep-seated or intermittent.
Okay, so culture is the gold standard for confirming the infection, but the imaging helps figure out where it is, upper versus lower tract. What might that imaging show?
Right. Imaging is key for that presumptive localization. On an ultrasound, signs that might suggest pyelonephritis include dilation or widening of the renal pelvis and the part of the ureter closest to the kidney.
The collecting area and the tube leaving it.
Yeah. And sometimes they see what's described as a hyperechoic mucosal line, like a brighter white line within the lining of the renal pelvis or ureter.
Okay.
If they did an intravenous urography, which involves injecting contrast dye, they might see decreased contrast uptake in the kidneys, a dilated or sort of blunted-looking renal pelvis, maybe a lack of the dye, filling the smaller collecting diverticula, and again, a dilated proximal ureter.
And kidney size.
Kidney size can also be a clue. As mentioned, maybe larger in acute cases due to swelling, smaller with an irregular surface in chronic cases due to scarring.
Right.
And of course, imaging might also show if there are any nephroliths, those kidney stones, present.
Got it. So all these pieces of the puzzle kind of build the case. What about getting a definitive diagnosis? You mentioned actually sampling the kidney itself earlier. How is that done?
Yes, according to the sources, a truly definitive diagnosis requires getting a sample directly from the renal pelvis or the kidney tissue.
How?
One way is pyelocentesis. That's sampling urine directly from the renal pelvis, often guided by ultrasound, or maybe done during surgery if the abdomen is already open for another reason.
Okay.
The other way is a renal biopsy, taking a small piece of the kidney tissue itself. The sources point out that biopsy requires expertise, and because the inflammation can be patchy, kind of spread out unevenly,
You might miss it.
there's a risk the sample might miss the affected areas, yeah.
So definitive diagnosis is possible, but sounds more invasive and maybe isn't always straightforward or even necessary for starting treatment.
That seems to be the takeaway, yes. Not usually needed for initial management.
And if they did examine the kidney tissue, say under a microscope after a biopsy or if a kidney was removed, what would they see pathologically?
The sources describe the microscopic findings. They'd see inflammation of different parts. The renal papilla, that's papillitis, the renal pelvis pyelitis, and the kidney's interstitial tissue, the tissue between the functional units, that's interstitial nephritis.
Lots of ionitis, meaning inflammation.
Exactly. Those rare leukocyte casts we talked about could potentially be seen within the kidney tubules. In chronic cases, the changes progress to scarring, dilation of the renal pelvis, and sometimes even the presence of actual pus.
Ugh. It paints a picture of significant inflammation and damage right inside the kidney structure. So once it's diagnosed, or at least strongly suspected based on all these tests, how is pyelonephritis treated?
The sources strongly emphasize that early aggressive therapy is crucial
Why so aggressive?
because delaying treatment or not treating it effectively enough can lead to severe, irreversible scarring of the kidneys. You want to hit it hard and fast.
Early and aggressive, got it.
Yeah.
Does the pet usually need to stay in the hospital?
Not always. The sources say treatment is typically done on an outpatient basis. Yeah, unless the pet is showing signs of septicemia, that widespread blood infection we talked about, or they have symptomatic renal failure. Those cases would definitely warrant hospitalization.
Okay. What about activity? Diet?
Activity generally doesn't need to be limited. Diet-wise, a modified renal diet, like the prescription K80 diets, is recommended if the pet also has chronic renal failure or if kidney stones are present.
Makes sense. What about surgery? You mentioned stones and blockages being major issues.
Yes, surgical considerations are really important, especially when there's obstruction. The sources highlight again that complete obstruction of an infected kidney or ureter with pyelonephritis is a medical emergency.
Because of that sepsis risk?
Exactly, the rapid risk of urosepsis. So the obstruction absolutely must be corrected, either with surgery or potentially using something like lithotripsy to break up stones.
Okay.
And infected kidney stones specifically need to be dealt with. That means removing them surgically, maybe trying to dissolve them medically if they're the struvite type, or fragmenting them.
And antibiotics around that procedure.
Absolutely critical. The sources are clear. Always use periprocedural antibiotics before, during, and after when you're manipulating potentially infected nephroliths. That's to minimize the risk of showering bacteria into the bloodstream.
Right. Stop it spreading. Now, interestingly, the sources mentioned that just removing one kidney, a unilateral nephrectomy, is usually not effective for suspected unilateral pyelonephritis.
Yeah, that's what they state.
Huh. That does seem counterintuitive, doesn't it? Why wouldn't taking out the infected kidney solve the problem if it's just on one side? Did the source explain why?
The sources don't explicitly detail the exact reasoning behind that statement, but the likely implication is that maybe the infection has already subtly ascended to the other kidney, even if it's not obvious yet, or perhaps the underlying predisposing factor that allowed it to happen in the first place hasn't been addressed.
Okay, so it might be bilateral already, or the root cause is still there.
That seems to be the thinking, yeah. It reinforces that just removing the kidney often isn't the whole solution, according to this text.
Got it. So removing the kidney isn't the magic bullet. The core medical treatment, then, is antibiotics, I assume.
Absolutely. And this is where basing the antibiotic selection on that quantitative urine culture and susceptibility testing is paramount. Non-negotiable, really.
You must use the CNS results.
The sources stress that, yes, you have to rely on those results to choose the right antibiotic. The chosen drug needs to be bactericidal, meaning it actively kills the bacteria, not just inhibits them.
Kills them dead.
Right. It needs to achieve good drug concentrations in both the bloodstream, serum, and the urine. And ideally, of course, it shouldn't be harmful to the kidneys themselves, nephrotoxic.
Makes sense. Get the right drug, make sure it gets where it needs to go, and don't cause more kidney damage.
Exactly. Now, a challenge highlighted in the sources is that even if you get high levels in the serum and urine, that doesn't always guarantee good penetration deep into the kidney tissue, specifically the renal medulla.
Why is that important?
That can make clearing chronic infections that are lurking in that deeper tissue really difficult.
So it's harder for the drugs to reach bugs hiding deep inside.
Potentially, yes. And the duration of treatment is significantly longer than for a simple bladder infection. The sources recommend a full therapeutic dose given orally for 4 to 6 weeks.
4 to 6 weeks. Wow, that's a really long course of antibiotics for a pet. Compliance from the owner must be a big factor.
It is a significant time commitment, absolutely. And compliance is indeed vital for success, something the sources stress repeatedly.
Okay. Any specific drugs to avoid or ones to be careful with?
Yes, they advise avoiding drugs that achieve good levels only in the urine but poor levels in the serum, like nitrofurantoin.
Why?
Because they won't effectively treat the infection within the kidney tissue. They just sterilize the urine.
Gotcha. Need tissue levels too.
Right. And while aminoglycosides, like gentamicin, are potent antibiotics, they should generally be avoided unless absolutely necessary based on the culture results because they carry a significant risk of kidney toxicity.
Don't want to damage the kidneys further.
Exactly.
Any other specific antibiotic precautions mentioned?
The sources do mention one class, trimethoprim sulfa combinations. If these are used for more than 4 weeks, which is likely going to be the case here given the recommended duration, they can potentially cause certain side effects, things like keratoconjunctivitis sicca or dry eye, certain blood count issues, dyscrasias, and sometimes joint inflammation, polyarthropathy. It's just something veterinarians need to be aware of and monitor for during that prolonged treatment.
Okay, that's a lot of important detail for the management. Now, looking longer term, what happens after that long course of treatment? What's the follow-up like and what's the prognosis?
Patient monitoring is described as absolutely critical by the sources.
Yeah.
You can't just finish the 4-6 weeks of antibiotics and assume everything's fine.
Right. Need to check.
Definitely. They recommend repeating urine cultures and urinalysis during treatment, maybe around 5 to 7 days after starting the antibiotic, just to confirm the chosen drug is actually working against the bacteria.
Like a mid-course progress check?
Exactly. And then importantly, after the full 4-6 week course of antibiotics is finished, repeat urine cultures and urinalysis are needed at 2 distinct time points.
2 times after finishing. When?
1 week after stopping the antibiotics, A&D again 4 weeks after stopping.
Why 2 checks afterwards?
To be really sure the infection has truly been eradicated and isn't just suppressed or lurking, waiting to come back.
Okay, thorough follow-up. And what about preventing it from coming back in the first place?
Prevention, according to the sources, primarily involves identifying and, where possible, eliminating those predisposing factors we talked about earlier.
Like fixing the anatomy?
Yeah. For example, surgically correcting anatomical issues like ectopic ureters if they were present and thought to be contributing to the problem. Addressing the root cause.
Makes sense. Fix the underlying vulnerability if you can. What are the potential complications if pyelonephritis isn't treated properly? Or maybe if it keeps coming back?
The sources list several pretty serious ones. Acute or chronic renal failure is a major concern. Recurrence of the pyelonephritis itself is common if underlying factors aren't managed.
Right.
The formation of those struvite stones, especially with urease-producing bacteria, septicemia and septic shock, which we know are emergencies, and even metastatic infection.
Spreading elsewhere.
Yeah, meaning the infection breaks off and spreads through the bloodstream to set up shop in other distant sites, like infecting heart valves or causing inflammation in joints.
Those are definitely serious outcomes. So putting it all together, what's the expected course and the overall prognosis for a pet diagnosed with this?
Well, for acute or subacute cases, the ones caught relatively early, the sources state the prognosis is generally fair to good.
That's encouraging.
Yes. Many pets can recover fully unless there are complicating factors present.
The unless. What are the big ones?
Things like those kidney stones we keep mentioning, pre-existing chronic renal failure, any kind of urinary obstruction, or maybe underlying tumors affecting the urinary tract.
So the prognosis is definitely better if it's caught early and isn't complicated by these other major issues.
Exactly. The sources also reiterate that chronic infections sitting within that deep renal medulla tissue can be particularly difficult to resolve completely because of those antibiotic penetration
A little
challenges.
hard to reach.
Can be. And if the pyelonephritis itself caused chronic renal failure, then the long-term prognosis really depends on how severe that kidney failure is and how quickly it progresses.
Okay.
And a key point repeated several times in the sources. Recurrence is highly likely if infected kidney stones are not removed or dissolved.
The stones really are a major, major ongoing risk factor, aren't they?
They absolutely are presented that way, yes.
Yeah.
A persistent nidus for infection.
So what should pet owners really take away from all this? What are the essential pieces of client education the sources recommend vets should be emphasizing?
The sources highlight several crucial points for you as the owner. First, remember that recurrent pyelonephritis can be asymptomatic.
Silent recurrence.
Exactly. It can come back without any obvious signs. This is precisely why those follow-up cultures are so essential. Even if your pet seems perfectly healthy and back to normal after treatment, you have to check.
Okay, point one. Follow-up is non-negotiable.
Right. Second, an unresolved chronic infection, one that maybe wasn't fully cleared or keeps simmering, can lead directly to irreversible chronic renal failure down the line.
So monitoring tracks that too.
Yes, regular follow-up helps document whether the infection is truly resolved or if, unfortunately, kidney function is starting to decline or worsen. Third, again, resolution of the infection is very unlikely if infected kidney stones are present and not removed or managed appropriately.
Deal with the stones.
You have to. And finally, compliance with the full long antibiotic course is absolutely vital for successful treatment. Stopping early just because the pet seems better is a big risk, according to the sources. It allows resistant bacteria to survive or the infection to relapse.
Finish the full course, do the follow-up cultures, manage the stones, watch for kidney failure. That really brings it all together. We've journeyed from understanding what pyelonephritis is, how it sneaks up the urinary tract, who gets it, the often subtle or even absent signs, how vets piece together the diagnosis using tests and imaging, the complexities of treatment, especially that long antibiotic course in dealing with stones or blockages.
Yeah, it's a lot to manage.
And finally, the critical importance of follow-up and managing those long-term risks. It really underscores how something linked to a common issue, a UTI, can actually be a serious hidden threat to a pet's kidney health.
It really does. It underscores how a breakdown in those natural defenses, maybe combined with potential underlying issues like stones or anatomical problems, can allow what seems like a simple infection to become something much more complicated and potentially damaging long-term.
Which leads us nicely to this final thought for you, the listener, to consider. Given the high likelihood that pyelonephritis can recur, especially when there are complicating factors involved like those persistent infected stones or other underlying health issues, and given that it can so often be a silent condition coming back without warning signs, how important is it for us to not just treat the infection when it flares up, but to really focus on understanding and managing those underlying risk factors that the sources point to?
Looking deeper.
Exactly. What proactive steps might you, working together with your veterinarian, take to address those specific predispositions your pet might have? Could that potentially prevent pyelonephritis from taking hold in the first place, or at least stop it from becoming a chronic, recurring problem? It really feels like a condition that demands looking beyond just the immediate infection to the bigger picture of your pet's overall urinary tract health and the specific vulnerabilities they might carry.